All right, healthcare heroes. Today I'm diving into the essential ventilator modes you use every day. Let's break these down quickly and clearly. First up, synchronized intermittent mandatory ventilation, or SIMV. This mode provides partial mechanical assistance while letting the patient breathe on their own. It's great for reducing the risk of hyperinflation or alkalosis. Next, assist control. Here you can set a controlled volume or pressure, and the ventilator ensures a minimum number of mandatory breaths. Patients can also trigger additional breaths, making this versatile. Then we have pressure control ventilation. This mode predetermines the patient's inspiratory pressure. The aeration depends on lung compliance and alveolar resistance. Moving on to pressure support ventilation, or PSV. This supports spontaneous breathing by providing a set level of pressure. It's often considered the most comfortable for active patients. Now, continuous positive airway pressure, or CPAP. This delivers air at a constant pressure during inspiration and expiration. It's mainly used for hypoxemic respiratory failure, but the patient must breathe on their own. Then there's continuous mandatory ventilation, CMV. Here, the ventilator completely controls breathing, providing set volumes and pressures at fixed intervals. Lastly, pressure-regulated volume control, PRVC. This mode tries to achieve a set tidal volume by adjusting pressure. That's a quick overview of these crucial ventilator modes. Keep these in mind during your shifts and stay awesome. Thanks for tuning in, and see you in the next video.